Gonna wait a few seconds just to make sure we're live.
Okay.
Okay. Hi everyone. We're back again with another webinar on behalf of International Association of Dental Students. Today we have Professor Ivo Krejci with us from Switzerland, and he's going to present us a very interesting topic, digitalization in dentistry, or as I put it on the topic, D&D. Maybe it would make it more interesting. But as we all know, technology is like going and going on every day, and we are having improvements and new technologies added to our major and dentistry every single year. So that's why Professor is going to today update us on the digital world of dentistry. And I have to apologize first for the delay because we were having some technical issues which were hopefully solved. But now we're going to continue with our interesting topic with Professor Ivo Krejci. I'm just going to now ask Professor to begin his presentation for us.
Thank you very much for this kind introduction. Is everything okay from the technical point of view? Can you hear me?
Yeah, we can perfectly hear you, but we don't have your screen.
Excellent.
But we don't have your screen. We just have your voice.
You do not have my screen?
No. If you
okay,
just
but no screen. Is it okay now? Can you see the screen?
Yes, we now have your screen.
Okay, let me just take this out. Start the presentation. Sorry for all these technical issues. And go to the first slide. Like this.
You now have your screen.
Is it okay now?
Yeah, everything is perfect. You're just so interested to hear about the topic. The stage is yours, Professor.
Thank you very much. So once again, I apologize a lot for all these technical issues. We had some troubles. We had to change the computer, but I hope that you now can hear me clearly. It's a real pleasure to be with you and to share with you some ideas about digitalization in dentistry. In fact, my lecture will not be about the details, so please do not expect that I will advise you how to use, for example, a 3D optical scanner or things like that. It is more a philosophical lecture on how dentistry may evolve in the next years, how digitalization may influence our profession, because to how I see the situation, you will be in business maybe for the next 35 to 40 years. So it's really a good idea to think about the future and maybe also to adopt a little bit on the developments which will take place years, but even forever. And the dentistry will stay there forever. And maybe this is an issue which maybe challenge it, especially if we are talking about traditional dentistry.
Professor, sorry to interrupt. Yes, like you just left the chat and joined, so you have to share your screen again with us.
No screen? You do not see my screen?
No, because suddenly you were dropped out of the chat and joined again.
Okay.
But you share your screen again with us.
Yes, wait a moment. How did this happen? How is it possible to get out? Okay, let me see.
Okay, you now have your
screen. Can you see
again.
the screen again?
Yes.
Is it okay?
Yeah, everything is perfect. Thank you.
Okay, thank you for your feedback. So again, let us challenge this idea that dentistry will be really forever, and especially the issue that traditional dentistry will be forever, such as implantology and traditional restorative dentistry. Because there are some analogies of, let's say, other issues where some kind of technological revolution completely changed the whole situation. Let me give an example. Some months ago, I was in Paris, and I was at Montmartre, and there was a very nice situation in respect to some people drawing some portraits of tourists. And as you can see on the left-hand side, there was one of these guys who was drawing tourists in a very, very natural way. And this drawing cost around 40 or 50 euros. Aside of him, there was another guy who was doing more of a caricature, so very, very simple drawings. And these drawings only cost something around 5 or 6 euros. And when I went further, as you can see on the right-hand side, all of a sudden, little picture. And of course, the price of the digital picture was not 50 euros, it was not 6 euros, but it's just some cents. So this digital technology completely changed the situation.
Sorry to interrupt
yes,
again and again. I don't know, for some reason, it's like you're getting dropped out of the call and joining again. So you still have to share your screen again with us.
This is really strange because basically I haven't changed anything on my computer.
I know.
So
it's just we have your voice, but we
yes, but the screen drops off. Yes, okay. Can share the screen again. Can you see it?
And now it's okay. And now it's okay.
Okay. This is really funny. Now you should see the screen again. Is that correct? Is it okay?
Yes, it's perfect now.
So what I showed you before was the development of handcraft, then simple handcraft. All of a sudden, digital technology completely changed the situation. And there is a further step, as you can see on this slide, selfies. So you do not even need another person to take the photograph. And of course, this costs even less than if you have another person who should take care of the pictures. So this is a very nice example of a disruptive technology which may completely, all of a sudden, change the situation. And it's a very nice example of what might happen also in the next years in dentistry. Coming back to photography, basically, I don't know whether you know the story of Kodak. Kodak was the leader in conventional, traditional photography.
I'm so sorry, guys, for this technical issue. I really don't know why this thing is happening. Professor has left our call again. I'm going to ask him to join back. I'm so sorry, and I apologize again. Professor is going to join us in seconds.
I'm back again. Is that correct?
Yes, you're back. I'm gonna make you present to everyone again. We were at the Kodak.
Yes, exactly. So let me see
Yeah.
whether I can continue with the presentation. I think if it cuts again, we will most probably stop the presentation and maybe schedule another meeting,
Maybe,
because
but
I have
I
no
hope
idea
everything.
what's going on.
Yeah, me neither. So if you can share your screen with us again, it will be perfect, so we can continue from
Okay,
Kodak.
this is what I'm doing. Can you see the screen now?
No, we have
No,
your own video.
you have my video. Really very, very strange. Let me check. Is
We
it
now
okay
have,
now?
yes, we now have your screen.
Yes. So now most probably you can see my screen. Is that correct?
Yes, the future.
Okay, so once again, sorry for all these issues. So, okay, that was just an example from a completely different, let's say, specialty. But coming back to the topic, so it might be interesting to think about some factors which might also completely change dentistry in the next few years, a little bit similar to what I showed you in the field of photography. And there's one book which very much impressed me when talking about future, which is called Vaporized. It has nothing to do with dentistry, in fact, but the thesis of this book is quite interesting and might also concern the dental field. Basically, what the author is saying is that everything which can be vaporized technically will be vaporized. Vaporized means virtualized. And if you look at dentistry, the question is, what items in dentistry could be virtualized? Basically, by talking about this field, we are talking about three different actors. One actor in dentistry is the dental technician. Another actor is the patient. And of course, the third and maybe the most important factor and actor is the dentist. Let me give some ideas about how these actors might be influenced by digitalization. Let's look, for example, on manufacturing. Manufacturing of restorations, maybe manufacturing of splints, manufacturing of many different dental products.
Sorry, guys. I don't know for what reason this is happening. I'm trying to get Professor back again with us, and if this happens again, we have to reschedule the webinar for another time.
It's 10 o'clock.
So, meanwhile, what do you want to hear from me? Maybe a history of IADS. But so far, the webinar was so interesting, wasn't it? About the digital world and how the world is getting evolved. Pretty interesting. Professor is going to join us soon again, one last time. And we'll see. I'm doing my best to get Professor back to you as soon as I can. Professor is having problems to join us. I think he will not be able to continue his presentation. If he cannot join, I will just inform you by email. I'll just email you about the reschedule of the date so we can have him again soon. Because for no reason, this thing is happening by surprise and we cannot have him. But we're doing our best to get him back to the call, and if the problem persists, we have to reschedule. So go and have a break, like for maybe 5 minutes, and taking a coffee, some snacks, glass of water. Okay, Professor is asking to reschedule because he's having connection problems to join us. Okay. So let's just show you a video. And for the webinar, we have to reschedule. Okay. Unfortunately, we cannot continue at this point since due to connection technical issues by Professor's side and probably internet problems, and he cannot join us again. I will reschedule and email you about it, and I apologize again on behalf of International Association of Dental Students. I hope you enjoyed, but it was not much to enjoy, but hopefully when I reschedule, you will enjoy it to the max again. Thank you and have a good evening.